Welcome to the WRAL Daily Download. I'm Grace Holland. The North Carolina State Health Plan provides insurance to hundreds of thousands of current and former state workers and their families. It's a big deal for those state workers. It was also a big deal in Washington earlier this week at the center of a debate on Capitol Hill over drug prices. Members of Congress have been focused on the state's plan's coverage of popular weight loss drugs. WRAL Capitol Bureau Chief Laura Leslie joins us to walk us through the ongoing battle. Laura, thanks for being here.
Thanks.
So in the past few years, these GLP-1 drugs have been wildly popular. What has sparked that boom?
Well, for one thing, because they're so effective, right? So they mimic a hormone that basically tells you that you're full. So you don't want to eat. And so, they were originally designed for diabetes to help lower blood sugar, but then they were discovered, that's Ozempic.
Right.
And then it was discovered that they're really effective for weight loss as well. And so that's Wegovy. And so they got used by some celebrities. They got very, very popular. There are spas where they can write you prescriptions for these things. So they've really kind of taken off as the people's sort of answer to years of dieting maybe that didn't work.
So they also come with a fairly hefty price tag, at least if you're using them for weight loss purposes sometimes in the U.S. So how much more are Americans paying for these drugs than people in other countries?
A lot. And that really will surprise you. I mean, in America, let's say, the U.S., you're looking at probably, we'll say, about $1,000 a month for Ozempic, right? It's like in double digits in other countries, right? So we're paying multiple times more than other countries are. I think it's $59 in Germany. And then for Wegovy, it's even a bigger difference. It's $13.50 in the US for 1 month supply, $92 in the UK.
Wow.
So, big, huge difference. And that's one of the things that lawmakers and the senators and also Dale Folwell, the head of the state health plan, has been pushing about. They're like, how is it that you can make a profit? Obviously, you're making a profit in these other countries selling it for this amount, and yet you're charging our system this much money.
Right. And North Carolina and its health plan found itself in the middle of a debate over the cost of these drugs. Tell us about the health plan and why we have the attention of federal lawmakers.
Right. And a lot of that, well, we sort of became I don't want to say the poster child, but sort of for this issue because our state health plan ran into trouble with this. So we have about 750,000 people on this plan, and these drugs started to get more and more popular. And when I say more and more, I mean exponential growth.
It exploded.
Right. So they said, just in last year, it was I think $100 million after rebates. Right. And then if it kept growing the way it had been growing, it was going to be $170 million this year, $1.2 billion over 5 years. It said basically this is going to bankrupt the health plan because it's self-funded. Right. It all pays for itself. So what they thought was, well, let's look and see whether we can limit the coverage of this weight loss drug to people who are morbidly obese or very obese, right? So set a BMI limit for that. And what they were told by CVS Caremark, who's the manager of the pharmacy plan, and Novo Nordisk, who's the drug maker, they were told that they could not put any limits on coverage or they would lose their rebates. So they said, well, if we have to do that, then we're just not going to cover it. So that was the decision that was made. It was made in January. It took effect in April. Very unpopular. And a lot of people out there, members of the state health plan and their doctors saying, there are real health benefits to people who are overweight being able to lose that weight. Why are they not, able to get the care that they need when other people are?
All right. Let's take a quick break right there. When we come back, we'll hear about this week's congressional hearing over weight loss drugs. Stick around. North Carolina Treasurer Dale Folwell is leading this crusade in North Carolina. He's a Republican, and he's found himself aligned with Senator Bernie Sanders, who is much further to the left. So,
it's kind of like the odd couple, isn't it?
Yeah. So, Laura, how is that relationship working?
Well, both of them were interested in trying to rein in prescription drug prices, right? Coming from very different philosophical backgrounds, but very pragmatically, they're aligned with each other. And so Falwell has been a frequent guest of Senator Sanders, frequent witness testifying at hearings and so on this particular issue. And this is something that Sanders is really passionate about as well, because, he says when you think about it, these are really miracle drugs in a lot of ways. I mean, they're starting to be prescribed now for heart attack prevention. They're looking into what they can do for addiction and what they can do for dementia. So there's a lot of potential for these drugs, but at the price that they're charging in the U.S., they're saying it could. Sanders said, this could literally bankrupt the healthcare system. And the answer they had. Mr. Jorgensen, who is the CEO of Novo Nordisk, and he was there to answer questions. And he said, well, but that's not what the consumer pays. The consumer's paying $25 copay out of the pocket. But the health plan is paying the rest of it, right?
Right.
The insurers. And that is the problem. And so, Sanders is saying we've got to do something to get this price down before this drug becomes even more popular, and we don't have a way to accommodate that, to absorb that expense into the system that we have.
Right. And I was going to ask you about that testimony from the CEO. Was there anything else that stood out from what he said?
Well, I think, one of the points he made over and over again is that this money pays for research, and it took decades to bring this drug. And there were many other versions of it that didn't make it, and those obviously aren't providing return on investment. But Sanders countered that the U.S. seems to pay a much higher portion of the R&D costs than other countries do, and said, surely there's got to be a way. And even Republican senators pointed this out. Surely there's got to be a way to try to even this out a little bit, so other countries are paying a little bit more, and we're not having to cover the whole cost of that. He also pointed the finger at what we call pharmacy benefit managers. And that's like a middleman that has come up between sort of insurance companies or insurance plans, I should say, and the pharmaceutical industry. And they basically are sort of gatekeepers for who gets what drug at what price. So they go in and they say they provide a service because they negotiate for rebates, but they make their money off of a percentage of the drugs that they sell. So they have a perverse incentive to keep drug costs high because they get a higher percentage of the cost of the drug as their reward. Right? So there's been a push afoot in the Senate for the past year to what they call delink that, to basically do some reforms on pharmacy benefit manager companies so that they get a flat fee for the drug, no matter how much the drug costs, to at least remove one of the reasons why these drugs may be remaining at such a high list price.
Okay. In recent months, Falwell has been negotiating with Novo Nordisk over these prices. How is that going?
Not well. They have been at impasse for months. Falwell says every time he brings another, because he is the executor of the state health plan, but it's actually run by a board, and they make the decisions. And so they have been trying to go back and forth for about a year now with Novo saying, well, what if we did this? What if we did that? Could we keep the rebate? And they keep getting the answer is no. It's kind of like it's got to be available to everybody or you don't get the rebate. And, there's also a PBM involved in this one, CVS Caremark, and they are saying, we will pass the rebate on 100% if we can get that rebate back. So you got three people kind of pointing the fingers at each other, but because of the sort of opaque nature of how this works and the system, there's no transparency, right? You have no idea what this is where all this money is going. He says there's really no way to know like who is really sort of holding things up.
Right. It strikes me that it's unusual to see a Republican taking on big drug makers like this. Is Falwell facing any political pushback from his position and the way that he's handling all of this? And what about Novo operations in North Carolina, any of that stuff?
Well, this is not his first crusade. He is known to be somebody who likes to go after what he calls the hospital cartels. So he's been sort of on a mission to do something about hospital prices, healthcare prices, drug prices, et cetera. And so he, and this is in large part a function of his job as the person who takes care of the state health plan, right? Because he's basically got the state health plan that is underfunded by lawmakers by hundreds of millions of dollars, right? So they've got to try to find a way to keep it solvent, keep it working without raising rates too much more because the rates are already getting uncompetitive, and without going in the hole, which is they're pretty close to. And so, he's trying hard to sort of walk that line. And this whole sort of campaign of his is a part of that. It's also sort of a populist push. And we also saw that with Blue Cross. He is somebody who has been a constant critic of Blue Cross, the state's biggest insurer, used to be the person who handled the state health plan. It no longer is. It was changed to Aetna, and a lot of that was because of dissatisfaction with Blue Cross and and the way that went. And he did not make himself very popular with state lawmakers because Blue Cross is a very powerful lobby interest at the legislature. They have a lot of money and they spread it around, and so he had a lot of bills trying to do things about medical debt, trying to do things about hospital costs, and things get stymied at every turn because the big insurers don't like them, and his things, the things that he has tried to rein in Blue Cross obviously have been, stymied by Blue Cross.
So with all that in mind, I mean, where do we go from here? Do you think that there's going to be a time when the state health plan will cover these drugs again?
I think they're going to have to, right? But I think something is going to have to give in order for them to afford that. I mean, I will point out Novo Nordisk, big investor here in North Carolina. They just, signed on the line to invest another $4 billion in another, finishing facility here in Johnson County. So this is not somebody that you can make mad for, with impunity, right? They're important to the economy. At the same time, I think the message was clear from members all around the committee that, that Senate committee that took place this week, that this is simply not sustainable. And so, Sanders pushed, and Mr. Jorgensen said, that he would sit down with the three biggest pharmacy benefit managers and see if they could come to some agreement to try to lower the cost to some extent for Wegovy especially, to try to make sure that these drugs are available to more people.
All right. Well, thank you so much, Laura. We know you'll stay on top of it. That's WRAL Capitol Bureau Chief Laura Leslie for our coverage on the battle over drug prices in North Carolina. You can go to NC Capital section of WRAL.com. I'm Grace Holland. Thanks for joining us, and thank you for listening to the WRAL Daily Download and for making us a part of your morning routine. Another great way to get WRAL news is the Morning Briefing newsletter. It's a daily email with Triangle news, events, and headlines to help you get ready for the day. Sign up at WRAL.com/newsletter.